St. Luke's Health Center in Hazleton held a ribbon-cutting ceremony on Friday at the Churchill Mall. We were there to learn what the medical facility will offer the community.
We are really excited to open the St. Luke's Health Center at Hazleton today, which is going to house our Care Now facility, which is an urgent care walk-in facility. We have our primary care office here with our family medicine physician, Dr. Perez Figuero. We have our physical therapy site here. We have outpatient lab services and outpatient radiology services.
So there's a lot going on right here, and I think handy off the top of my head, because if you do call your primary care doctor, you're not feeling great, it can be a little frustrating sometimes. You could come here, and that's very convenient, and a lot of other services.
Absolutely. So if it's after hours when your primary care office is closed, or you're not able to be seen for whatever reason by your primary care provider, or for some people they don't even have a primary care provider, urgent care is a great option. You really don't want to go to the emergency department for non-threatening injuries. You don't want to sit in a waiting room if you don't have to sit in a waiting room, and we want to make sure that we're providing access to good care for those non-life-threatening injuries and minor illnesses. So that's what our urgent cares are here to do.
You made a point to say, hey, this is a community hospital and healthcare system.
Absolutely, hands down. Our staff are embedded in this community that they serve. They're treating their neighbors, their families, their friends, and we are very much about bringing our services to our community rather than expecting our patients to find us and to come to us. So as much as we can provide real easy access to patients in their home communities, we know that they're more likely to seek care and to be compliant with healthcare recommendations when they can easily access care. So that's what this is all about.
So a family physician really starts from the newborn stage of life and carries over all the way into end of life care, which is the beautiful thing about it, right? So you get to have someone through the trajectory of all of the different things and phases of life. So that's my favorite part. It's that continuity, that longitudinal experience that you get with the patients.
Is that why you kind of like your job too? You do get to know people and interact with them?
So I love talking to people.
Yeah.
I love interacting with people. I'm definitely an extrovert. It's just on TV, it's a little bit different.
It is different.
We'll see how it goes. But it is. I love meeting new people, hearing their experiences, getting to be a part of their whole life experience is probably one of the most rewarding things about being a family medicine physician.
So if someone comes in, they're looking for a family doctor, they could come here, they'll get you. You would be the person they see, or the other, yeah.
So they would get me. I do have residents because I am part of faculty for the St. Luke's Miners campus. So they can meet all of the different residents that we have because they will be rotating through. But I will always be here as the primary care physician for the whole office.
How cool is that for Hazleton to have that residency program and also to be a part of this?
I know, I love it. So I've already been kind of told that I will be giving free Spanish lessons to all the residents while I'm doing some of the precepting. So I'm excited to have them here as well.
So that's excellent. So you speak Spanish as well, which is great, yeah.
Absolutely, yep. Born and raised, Puerto Rican.
Tell me about the building a little bit in that. What do you like about it? I guess it's home for you now. Away from home.
Oh, I know. So what I love about the building is that we not only have this primary care office, but we have the urgent care office, and then we also have the physical therapy office. So the ability to say, okay, listen, I want you to go ahead, get this lab work done or get these studies done. Patients can literally walk over and get it done and not have to drive, 20 minutes to the nearest hospital just to get things done. So I love that about it, the convenience of having a primary care office, urgent cares, and different specialties. And hopefully we'll be able to get a couple more specialties in the future.
Sometimes people are intimidated. There's a lot of things in healthcare. They're nervous in general. This seems very welcoming. You seem very welcoming. And it's probably very important for people. Come get a checkup and go see your doctor.
I think the most important thing when getting any type of care is that you feel that you have a strong connection and a strong rapport with your provider. You will probably be the most vulnerable you have been in your life coming into these rooms, talking to the provider, and it has to be someone that you can really connect with. So I think that's the most important part in finding that primary care physician that really fits you. And it's not easy sometimes for primary care physicians when there's just so much need and you want to fill that space. So I'm hoping I'll do it justice and I'll do a great job while I'm here.
Dr. Ileana Perez Figueroa also has a message for the Spanish-speaking members of our community.
Una de las cosas lo que cual encuentro es bien importante cuando están buscando una doctora de cabecera es que en su vida va a pasar muchos momentos difíciles, tiene que ser bien vulnerable. Entonces, para tener una doctora que pueda conectar, que pueda entender lo que esté pasando, eso es una de las cosas que, si Dios quiere, le hago justicia en esta oficina, y pues vamos a seguir tratando de encontrar a todas las personas que tienen esa necesidad en la comunidad para servirles mejor.